Low-grade fever occurs when body temperature is more than 99 degrees Fahrenheit but less than 100.3 degrees Fahrenheit. Generally, a fever is a sign that the body is fighting against something, possibly an infection or inflammation. A low-grade fever lasting for several days is usually not a cause for concern. However, if it persists for more than a week, medical evaluation is important. The most common cause of low-grade fever is chronic infection. Infections are responsible for around 40% of low-grade fever cases. Conditions such as urinary tract infection, tuberculosis, or endocarditis can cause low-grade fever. Symptoms of a urinary tract infection include a burning sensation during urination and cloudy or smelly urine. For tuberculosis, symptoms might include a cough lasting more than 3 weeks, sometimes with bloody sputum, night sweats, and unexplained weight loss. During endocarditis, symptoms can include aching joints, heart murmurs, weakness, leg swelling, and shortness of breath. In approximately 20% of cases, low-grade fever is due to an autoimmune disease such as rheumatoid arthritis, lupus, or inflammatory bowel disease. Joint pain, especially after a period of inactivity or in the morning, is a primary symptom of rheumatoid arthritis. For lupus, a common symptom is a butterfly-shaped rash across the cheeks and nose. Symptoms of inflammatory bowel disease include abdominal pain, cramping, diarrhea, and sometimes blood in the stool. Medications, including antibiotics, anticonvulsants, and some hormones, can also cause fever, particularly if the onset of fever coincides with the start of medication intake. In about 10% of cases, the cause is fever of unknown origin, where there is no identified underlying cause, necessitating further investigation. In 5% of cases, fever can be a sign of cancer, although it is rare for fever to be the only symptom of cancer. Both Hodgkin and non-Hodgkin lymphoma can present with intermittent fever, which comes and goes over a period of days or weeks. However, fever is not an early symptom of lymphoma. In leukemia, both acute and chronic types, fever can be a symptom, especially in the early stages of acute leukemia. For other cancers, fever is generally not an early symptom.